Welcome to the Mint Condition Podcast. I'm Brad, and I've got Dr. Jackson from Murray Chiropractic, Auto Accident, right?
Yeah.
So Dr. Jackson is going to talk to us today about getting care at chiropractic in general, but especially for auto accidents, and then anything else you feel about healthcare.
Happy to provide. Yeah, let's do it.
Thanks for joining us.
Yeah, thanks.
So tell me about your clinic. Do you guys only do auto accident? Is there a variety?
Yeah, we try to have a good diversity of kind of patient base and, where we're working. So probably like 35% of our clinic is auto accidents.
Okay.
Maybe 40, but, we try to do, keep it balanced between it all for sure.
Yeah.
But
so you guys are
it's
definitely available.
Yeah, definitely available, flexible. We try to have unique hours to help offset stuff. And, we have a lot of diversity with care, so it gives us opportunities to see a lot of different types of cases, which I like.
Yeah.
It's not just the same one condition every time.
Yeah. And that way you can take care of a person and be their provider. They've got headaches, and then 6 months later or 2 years later, they've got a back pain issue.
100%. Yeah.
You can be their provider. What I really like with your clinic is you're right off the freeway.
Yeah.
You got 215, I-15.
Pretty convenient, yeah.
Yeah, that's awesome. That's cool. How long have you been at that clinic?
I've been there for a year now.
Okay.
And so we have a little sister clinic situation. So
Yeah.
we have a clinic in Draper and then in Salem.
That's great.
Which every now and then it's also nice because we will share patients. If we have people that commute or move, sometimes they'll bounce back and forth between all three, and that's nice because we have all the doctors collaborating together.
Yeah.
So that's also one of the benefits I like is if a patient comes in and I can tell they're a little, maybe they need some more reassurance or even just skeptical about our ability to help them. One thing I like to be able to pull out is, it's not just me looking at their case. I have 3 other docs with a combined 60 years of practice to bounce off of. And so if I ever run into a question, that's my next step is to go to them. And that can reassure sometimes.
I think that makes a big difference because people are. I've even seen this. I don't know if you've dealt with this, but I've had patients where I'm like, "Hey, we're going to do some cupping, and then we're going to do this, that, the other," and they'll turn and look at my receptionist, and my receptionist will nod, and they'll say, "Okay, yeah, let's do that."
Yeah.
The receptionist, which our receptionists are great, but they aren't medically trained. But people need that second opinion, that reassurance, and
100%,
and to know because it's new to them and can be scary. Pain is scary.
People learn to live with what they have, and the idea of relief is appealing, but getting worse is sometimes that's bigger, and so they will stay stuck or in pain versus the potential for worse. And
that's
I think
a good point.
Right? Like, man, I could talk about that part for a while, but
I actually like that you brought that up. I hadn't thought about it quite that way. That's why they're avoiding it, because will this make me worse?
Mm-hmm. Oh, I feel like that's a lot of not a lot, but we experience that a lot. And sometimes when I notice that people's energies seeming hesitant about, our next steps, I'll address that. You've had to deal with this. It's been hard. It might get a little weird for a second, but that's because your body's actually going to be showing you that it's changing.
Yeah.
That's actually good. Symptoms, we were raised, symptoms are bad, right? If you have a symptom, something's wrong with you. Something might be changing though. And that's really what I like to tell people is symptoms are feedback from something going on in your body. And if they go on for a long time negative way, then that's a problem. But if they're, showing that flexibility, then that's a good thing. And I think too, people like to know that I'm not just saying the yes man stuff, right?
Yeah.
I think there's something about the humanity aspect, kind of looking at the receptionist. He's not just giving you a song and dance. And I am very authentic with people. I will, I have no problem in a first or second visit when we're going through what their issues are. If they're not the right fit, I will push them to a different provider, whether it's in chiropractic, PT, whatever. It's more important for me to sleep well at night and to feel good than
to hold on and
because I really, when I went into this, I want every patient to be treated as if they were my own mom somewhere, and that is more important. And that I think always comes back on the business side of it, right? Because people get worried they have to, cling on to everyone, and every problem is a problem that they can solve. I don't want to take that on, you know, especially if it is something that I know I really can't help with.
See, I like that a lot. When I go into any store, like Men's Warehouse, and I feel like you're going to get commissions off selling me, so you're telling me it looks good when it doesn't. Mm-hmm. I need your honest opinion. I love is it Miracle on 34th Street I think, where
Oh man.
he's Santa Claus. And he's sending them to other stores because it's cheaper there, or what they were looking for in the store he's at doesn't hold it. And the store at first was like, "What are you doing?" And then they wait a sec, everybody loves us because of this. Please keep doing that. Like, and I love that concept. What if we actually just take care of people?
Yep. And that, man, people, I feel like they become so much more, I don't like the phrase bought in, but they appreciate that realness. And I don't know, I just think in healthcare, in today's world, people need to feel connected to, right?
Yeah.
It's one of my biggest flexes is our patients oftentimes will, at some point in their care with us, go, "You remember that?
Yeah.
I told you like 2 months ago about this random detail that my daughter's recital, and you just pulled it out 2 months later and asked me." Like, that's a big flex for me. I really want people to feel like their issues are a priority, but I care about them as a person. I love just taking care of that too.
Yeah.
So
I think there's enough problems in the world to solve that we don't need to make fake ones.
Yeah.
So the one other bad story for you. I went to get my eyes checked out. I couldn't see like more than 3 inches in front of my face. I got really blurry, and it ended up being because I wasn't sleeping at all. And lack of sleep can do that to you. But I went to the eye doctor, and I had 20/10 vision growing up.
Okay.
Really good. And he tests my eyes, and they were down to, one was 2015, the other was 2020.
Okay.
And he's like, "Well, we got to get you back to 2010. So you need to buy this $1,000 pair of prism glasses."
Yeah.
Was he doing what was right for me, or what was right for his business and making money? And that's what we have to bring back to healthcare is trust. Is you're not just trying to up my bill or have me do the runaround before getting the actual care I need. So.
That, when I was interviewing with this clinic that I'm with now, that was one of the things that I was hooked by when I met with the owner. She was talking about their mission, their, patient focus, and it was very much about that. Like, our goal is care focused. It is not about the bottom line. It is not about pushing certain, auto accident case limits to the max.
Right.
If we resolve something with a third of this, great. That is really always going to be our focus. And I thought, I've worked with a couple other clinics, and I've never had that truly told and then
follow
practiced.
through.
And it's super important. And that is also, I think, what people, feel when we talk to them, right?
Yep.
They know if they're being given a bogus recommendation that is just so disproportionate to what they really have.
Yeah. What is interesting is how that can negatively impact your relationships with lawyers.
Oh, gosh, yeah.
Do you know what's fun, though, is those are the lawyers you don't want to work with anyway.
Right, yeah.
So the lawyers are like, "No, I want to work with chiropractors who run up the bill no matter what." And it's like, no, you guys go find the chiropractor or the PT who will do that.
Yep.
And you and me, let's work with the lawyers who are like patient first.
100%. Totally. I love it, yeah.
Yeah. Well, do you guys have any specialties or anything that you hyper focus on in your clinic, or is it?
It's been a general clinic for a long time, and just because of the flexibility, we've had a couple docs, and so a lot of some have had different specialties. My personal background is with upper cervical spine. I fell in love with that halfway through chiropractic school because one of my I fell into chiropractic. I wanted to be a physical therapist. Got my bachelor's in exercise science.
That's cool.
I moved to Texas thinking of the 15 PT schools that a few of them were my
There's
gimmies.
15 in Texas. Dang.
There might be. There was a ton when I did the PT cast. Just a billion were in Texas.
Just Texas. It's a big state, so it makes sense.
So I kind of thought and I'd worked in a PT clinic for a long time, had good letters of rec. I felt like I was a decent, strong candidate.
Yeah.
And then all of my Texas schools, I was either waitlisted or denied, and then I got into PT programs, Rockhurst. Yep. And University of New England.
Yeah.
And so I thought, well, do I want to move to Portland, Maine?
Yeah.
Or St. Louis when I'm from Oregon? So I had to kind of have a future battle plan meeting with myself, and ended up going the chiropractic route. But because of that, I came into chiropractic, no work experience, no patient experience. I just wanted to work in healthcare. I wanted to work on the reactive, proactive, musculoskeletal side of things.
Yeah.
And so because of that, chiropractic school, I had no blinders or no preset opinions. And one of my issues is when is a patient done needing to be adjusted, right? If, I shouldn't need to adjust the patient every week for the rest of their lives. We should reach a point.
Right.
And in upper cervical chiropractic, there's a few techniques. That was what they did. They used infrared testing to show pre and post adjustment. We established neurological patterns that would show when a patient came in, they're in need of adjustment today, they're not in need of an adjustment. And I thought, this is cool.
That's awesome. So it's a
objective measure.
Yeah, objective measure. That's a good way to say that. Yeah, that makes a big difference. I mean, there are, I'm sure, different chiropractors and different PTs with strong opinions on you should get adjusted for your whole life or you should never get adjusted, right? The full spectrum.
And I can argue both too. I mean, I understand the rationale. Like, we're very immobile.
Yeah.
Right. And so encouraging people to have joint movement, range of motion work. Yeah, that is important.
And there's always benefit to it, but medically needed versus just generally healthier, right?
Yep.
I love getting adjusted. I'll go for once a week the rest of my life just because it feels good, but medically do I need that? Is, I think, where that difference is, right?
Mm-hmm.
So that's really cool. And I like that you've got that PT background. You fall into chiropractic. PT and chiros are very hand in hand, right? A lot of overlap there. We're both aiming for the same thing. So how have you seen your background in PT?
I think just a lot of like extreme openness to collaboration and, what is this patient really needing? Are they needing what I can, the best way I can think about it is I wake up, I think about chiropractic a lot. I think about the chiropractic technique, adjustment, methodology for needing an adjustment. I don't think a lot about the therapeutic healthcare benefits of different forms of physical therapy. I'm not up to date on the best research, on the best PT delivery systems, right? I have a little bit of knowledge from school. We go over it. Yeah, there's a little bit of knowledge from life, but I don't really feel like an expert in those areas. And so for me to try to present myself as one to a patient and try to do those things, why would I do that? Yeah. Whereas I know people that I'd rather do what I do really well and work with someone who does what they do really well.
Right.
And then we just rock it.
One thing I really like, though, especially with you having that background, but any chiropractor, because you guys all chiropractors know how the body works, and we all learn anatomy and some of these concepts, is this concept of you still teach people exercises to do at home.
Oh, yeah.
Right? Yeah. And does everybody need a PT and a chiro? No. Right? There is some overlap where they could have been just fine with one of us, and that's all they needed. And sometimes they need both of us, but the fact is you're able to help them on that full spectrum on a home exercise program, and even educating them on movement and postures and stuff in their sleeping posture or whatever. So I think there's a lot of benefit to that. And then, like you said, collaborating when more rehab's needed. A lot of chiropractors I've talked to are like, I really don't want to do 30 minutes of exercise with somebody.
Yeah.
And it's like, oh, that's what I do want to do. So that's smart. I like that. Have you seen a lot of benefit in your experience with auto accidents specifically, the PTs and chiropractors working together? What complications have you run into?
I think it just depends on the right clinic philosophies lining up, right? And it's hard because really, I mean, if you want to, try to see where chiropractors and PTs are unique, there is so much overlap, at least to the naked eye of like neuromusculoskeletal. Like we both
and a lot of modalities.
Yeah, incorporation of different modalities. Like they really are very similar, but there's a lot of like I think, practice why behind each one that is different. Like chiropractic has a crazy story because it was originally debated, should it be a religion or should it be a healthcare profession?
No way.
Oh yeah. It was, I don't want to derail you, but
no, you're good.
Chiropractic was
interesting.
Was founded in 1894 by a guy named D.D. Palmer, who was in Iowa, and he had been a magnetic healer. He was, just interested in the body and kind of, and in the 1800s, there was this revivalism, right, of just spiritualism and health and tonics and all that.
Right.
And he kind of developed this system of looking to the spine and the health of the spine and its alignment for effect on the body, which makes sense.
It totally makes sense.
Your spine protects your spinal cord. Spinal cord goes to every vital organ in the body.
Yeah.
If there's misalignment, if there's pressure, if there's imbalance, that could and maybe will have neurological consequences.
Yeah.
So he developed this system, brought his son in, and they had this conversation of, do we go profession or religion?
Like, that was his decision. It wasn't society making
No.
that decision. He was like, which direction?
He's considered the father of chiropractic. D.D.
And
Palmer.
what was his reasoning? Because I totally get, like, profession makes sense.
His son was a little bit more of like the entrepreneur and like, no, Dad, this is like, this can be a healthcare delivery that we can show that isn't really being done. Because back then, DOs were on the up and up.
Yep.
And so it kind of became an issue of chiropractors looked to the nervous system, DOs looked to the blood.
Right.
You know, they thought everything was bloodborne. And so
That's why
said,
they did bloodletting and all that stuff.
Yep.
Yeah.
So they said, you know what, DOs are doing this, we're going to do nervous-centered care.
Which is the most powerful system in your body.
If you're gonna do
I
one.
could go on for hours about that.
Right?
But what I'm not understanding is what would have been the benefits of doing it as a religion?
Because I think that was Didi's approach. He was more just intrigued by the spiritual aspect. He liked
Interesting.
because if we want to get real deep with chiropractic, there's a term called chiropractic philosophy where when you provide an adjustment, it's not necessarily a mechanical correction. It's unlocking an innate force in the body that your innate intelligence is going to use for productive purposes.
Interesting.
And in that same thought, there can be inappropriate or unneeded external forces applied to the body that will jam up that innate intelligent pathway.
Right. Well, we see that in our diet, in dopamine
Chemical.
releases
Yep.
in our phones, all that chemical stuff.
And that's where chiropractic focused towards the upper cervical spine, because you look to the mechanics of the upper cervical spine. You know, it's the only section where there's not an intervertebral disc. The range of motion is greater. The purposes of those part of the brainstem with the pons and the medulla, they're doing grand processing. You have some of the major nuclei that have, you know, body-wide oversight.
Right.
And they are irritated when those upper cervical two vertebrae have misalignment and create an inflammation.
That's
and so
fascinating. I
they
haven't had anybody explain that to me like that.
Oh man, we could have some fun talks about it because
Yeah.
Didi thought more of it wasn't a correction of a physical problem. It was an introduction of a innate productive force that your body or your innate intelligence would use for productive purposes.
Right.
And it will handle it.
How much of this, because I haven't read
Sure.
all the chiropractic research, right? How much of this have they been able to back up more by research, not just by philosophy?
So this is the cool part then. So they decided, let's go profession. They opened the main chiropractic, the first one in Davenport, Iowa, Palmer, and they started to have classes. And his son, BJ Palmer, was thought to be the developer because he's the one who really flushed it out. And he was just persistent in research. Chiropractic really had an aggressive, research-centered beginning. They were some of the first to use X-ray. There are whole textbooks that they had to create because there wasn't anything else out there. You know, there weren't a lot of healthcare manuals outside of what they taught MDs maybe in their versions of school.
Right.
So they wrote their own textbooks. They were doing dissections. They were collecting skeletons and cadavers. They were doing all they could to show. They were doing X-rays. And one of my favorite things was in like 1910, they had a big symposium at that school, and they brought in a bunch of their graduates. And they had them all kind of line up with their gowns on, shirts back. So they had 50 chiropractors sitting, 50 patients, 50 chiropractors. And they did this massive study of do your analysis, find where the misalignments are, write it on a card, and rotate. And they went through and showed that palpation is very misleading. It can be very subjective. And so we need to find more objective forms of testing, whether it's X-ray, whether it's neurological. And then they did that. They started to build these different devices to try to show consistent, objective, regardless of the provider, the same results at the same location.
That's cool.
That needed a correction.
Yeah, in PT school, they showed us that same research.
Yeah.
Where they said, like, you can palpate and you're going to be wrong, right? I'm the gold standard. Everybody else is wrong because when I palpate, I get it right. If everybody else could just do as good as me,
One of my favorite moments of chiropractic school was our first day of class. We were in our first palpation lab, and we just, everyone kind of sat down next to whoever, and they're like, okay, guys, take your shirts off, girls, put your gowns on. We're gonna start learning, and my classmate was another big guy, and we were both like, oh man. Can I have the really skinny girl with the Stegosaurus
where you can feel
spine?
Everything, right?
And we were just like, this is going to suck. And it was a pretty funny laugh. And we were like, I think I can feel it.
Maybe.
Day one, I don't know what I'm feeling for. It's all skin.
All, right.
But our instructor was like, no, you guys are going to be the best come 12 weeks from now because you're going to have learned a lot of that really tactile difference.
Well, that's what they say is in PT school, we had to practice on everybody as much as possible. They were like, because even if you get good on a big guy like you and me, you're going to maybe be terrible on this skinny girl. Like you need to palpate different types of bodies. And that's a fun thing. I think just being in physical therapy, chiropractic, being able to be in tune with the body a little bit. When I'm working on people, I'm like, oh, right there, that's really painful. They're like, how did you know? Like,
funny,
you can
right?
feel it.
Yeah.
And that's why I really hate using gloves.
Oh, yeah.
I'm like, no, I need that extra
COVID
little
was horrible for that.
Yeah.
I mean, that was one of the parts that really, I was shocked at how much it disrupted my ability to connect and kind of understand stuff.
Not only your ability to feel it, which is important, but even connecting with people.
Yeah.
There's a lot of connection through touch, and I think healing through touch.
Well, and it's intimate. Like people are, they're laying on their table, belly up, belly down on their side. They're truly being kind of, they are exposed as a person when you're just laying there and someone's touching you. And so to be able to provide that reassurance with that, connection is important to maintain.
That's something that I've really emphasized is every patient I work with, I'll tell them often when you're in an office with a doctor, your dentist, whoever, you're like, well, they know what they're doing. They do.
Yeah.
But you're the boss. It's your body.
Yeah, totally.
And I learned this early. So I do headaches and migraines. It's like the main thing I work on. And some of the patients that I'd work with had a lot of PTSD from sexual trauma or whatever. Oh, there was a lot that I dealt with.
You're working on the neck.
Yeah,
you're working
on the
that,
neck. And I'm a 6'4" bald dude. Like,
that's a triggery thing.
All of these are triggers. And so I put a lot of effort into saying you're in charge. And I had this massage therapist who had been through like 3 different situations adding to all this trauma. And I was able to gain her trust, and she let me work with her. So I'm working with her, and she had me stop, and she said, hey, can you just stop for a second? And I stopped. She's like, can you remove your hands? And I was like, oh yeah. Oh. So I removed my hands, and she's like, something that would be beneficial for me and probably your other patients as a woman is if you teach us a safe word or a safe phrase. So the safe phrase was hands off.
Yeah.
So while I'm working, they just say hands off, and I just stop and remove my hands so that they knew they were in control of that touch of their body, which I have found very valuable. And
like, I know it shouldn't be, but like, it's also you having good humility. Because I could imagine some providers being annoyed at that.
Yeah.
Or miffed that they're disrupted in their flow.
Yeah.
And it's hey man,
well, and you think,
a human.
Yeah, it's a human that you're dealing with. So there's a PT who did her rotation with another PT, like in grad school in Vegas. Maybe I shouldn't be telling the story. I won't tell names. Does that count? So she's working with this PT. They have a patient total knee replacement, and he's bending the knee, and she's just crying and in a lot of pain, and he's pushing pretty hard from what I've been told. And it got to a point, it was so painful, she reached out and touched his hand, kind of like bracing, right? And he flipped at her and just was like, do not touch me. I know what I'm doing. I'm doing what will help you heal. And talk about unprofessional.
Yeah.
Like,
that's the horrible stuff, all right?
If any PT and any chiropractor treats a patient that way ever, you're in the wrong profession. Go be a garbage man or be a manager at McDonald's. Go do something else. Like, you should not be here. I don't know. I'm very passionate about that.
No, one of my clinics, I don't know how it worked out, but I started to have a lot of transgender patients that were in different forms of their transition. And I was really proud of that, actually, that they felt comfortable, because they told me, I will only come find you wherever you're working, because they'd had such bad experiences with other providers bringing their philosophies into their care and making the patient feel unsafe or unaccepted, and just kind of, it's one of those things where, hey, we all got our different beliefs, political, religious, whatever, but I think if you want to actually work in healthcare, you need to learn how to check that at the door, and everything goes off the table, because everyone, if you really have that health, I don't know, motto, promise, whatever, but like
morals
like,
or something.
if you are who you think you are as a healthcare provider, then it does not matter what that person looks like, is going through in that sense. They need to be taken care of and treated with the utmost respect. And if you can't check that, then go be a garbage man.
I was just teaching some of our therapists this concept where sometimes we lose the ability to remember that when you're treating a patient, you're not Dr. Jackson, you're a chiropractor.
Interesting.
So when somebody comes and sees me, they aren't like, "Hey, Brad,
What's up, Matt? How's it going?"
And right, they're not like, "Matt, what's your favorite?" And we connect on a personal level too, for sure.
Because the appropriate.
But why are they there?
Relationship. Yeah.
Is they need you as their doctor.
I like that distinction. I haven't thought like that.
And often we won't tell a patient a hard thing because that's Brad telling them, "No, I'm your PT telling you." It's a separate persona almost. Anyway, that's what I was thinking of as you were talking about leave it at the door. Brad, his opinions, his religion is at the door. Me as a PT telling you what any PT should be hopefully telling you, not based on my other biases. Right?
And like weirdly enough too, in Utah where we practice, right? Religion's just such a common topic of conversation and things we do. And so I really like to joke with people that, hey, you're all good here. I don't care where you're. And I'm LDS, but I grew up in Oregon. So if someone swears and they're like, "Oh my gosh, I'm so sorry," I always joke, I am an Oregon Mormon. You're all good. Let it fly, because truly I don't care. You can say or do what you need. I mean, be appropriate for our office setting. If there's a little kid next to you, please don't drop stuff. But as I am your chiropractor. You're not going to offend me as a person. I'm your chiropractor. So
it has nothing to do with you. I actually have wanted to create a sign that says swear-free zone. You're free to swear.
Totally. Because you're working on people sometimes.
It comes out. And it's like, be authentic. Don't be belligerent and aggressive and attacking people, but people should feel comfortable. And
okay if you let it fly.
Yeah.
I let it fly.
Yeah.
Why shouldn't they be able to?
Yeah.
I always like to joke afterwards that, the worst potty mouths are pregnant women.
Yeah.
They're the ones that just really let it fly sometimes when we're working on their low back or something. So
that's cool. Well, I love that you brought up pregnant women. So in PT school, they made us very afraid of some adjustments and even dry needling and other thing for pregnant women. What has been your experience?
Man, I don't know. Again, people could say it's maybe cavalier of a profession to feel like they can work with people. I mean, really, there are not so many conditions that we can't help with. There are almost every patient we can help in some capacity. Right. It might be greatly modulated or scaled, but most things we can at least get a little bit of help or give them some help in some direction. And so I don't think I've ever had to turn a person away based on small things. It's more of like, hey, I legit just hit my head this morning, and now I think I'm having a stroke. Like that kind of a thing, I'm going to refer you out.
Right.
But like pregnant women, no, I love it.
Yeah.
And there's not anything out there that really helps them with some of that stuff, right? I mean, add a 30-pound backpack to your low abdomen and see what that does to your body for 7 months.
Right.
You're going to have massive compromise and shifting happening.
Yep.
And for you just have to be told to endure it, that's horrible.
Yeah.
We have things that exist.
Yep.
So, no, I love it.
And I'm a big fan of that, exactly what you just said. All the time it's like you're pregnant, you need to sit there and don't move. There's pregnant women who run a marathon and then they go into labor 2 or 3 days later in their 40th week. It's the right timing. And I'm like, you can't go from never running, get pregnant, then run a marathon. Bad idea, probably. But if you're running before, if you're hiking before, stay active. There's too much fear, I think, behind some of that stuff.
And it does fall back on us to be like good doctors, to be aware of that. Because again, I don't want people to feel like, no, everyone's going to be great. Every person's fine. There will always be unique circumstances or ways we shift it. But as a whole, no, we don't need to be afraid. People need to be empowered really with a lot. And I always tell people, hey, a lot of men will mention like, oh yeah, my wife got pregnant. And I'll tell them, hey, keep them open to stuff as they get going. If they start to have just a lot of verbal complaints and discomfort, send them in. We have a lot of different things we do in the clinic to help not only lay down, but different things we're going to do. And we're not going to be doing maybe some of the more physical or aggressive adjustments. And that same line goes with kids. I adjusted my son when he was an hour old.
Yeah.
And people think you would do that, how torturous. And it's like, well, no, I'm not going to adjust him the same way I adjust a 30-year-old CrossFitter.
Yeah.
We're talking.
Put the Y strap on.
Yeah, the Y strap. Oh my gosh, let me start on the Y strap, man.
You're not a fan?
No, I'm a fan of distraction technique
Right.
care, of opening up facets and joints, but of hey, nice to meet you. Let me put the jet ski rope around you and yank and film it for the gram.
Right. Yeah.
That's pretty bold.
It's very bold.
I like the idea of what distraction therapy can do,
Yeah.
but if that's not having the right pre and post measurements, then
yeah.
what are you doing, man?
Well, and that's the problem at least my outside perspective. I'm not in there, but it seems like there's not enough of that pre and post testing.
Yeah, I think subjective pain, does that feel better, is not an appropriate way to gauge if something has been corrective,
Right.
like an adjustment. I rarely will ask them afterwards, how do you feel? I ask, tell me what you're experiencing. Is there different, do you have different like feeling sensation, heat, warmth? Let's look at your range of motion.
Yeah.
Because, that's so.
Well, how you
unproductive.
feel is so subjective. We talked about this earlier, where somebody can actually have more pain.
Yeah.
Right. And that's why they're sometimes scared to come in and get treatment. But it's what you're feeling as opposed to how you're functioning is the two questions.
Yep.
And when you function better, sometimes it feels weird, awkward, something. I do a lot of posture training. And when we fix people's posture, they're like, this is
miserable
not normal.
at first.
And I'm like, you're right, it's not normal. Your posture still sucks. You got to go even farther.
Yeah.
And it's miserable because they're used to this and not
It's
this.
subconscious. They don't understand how much So one of my favorite things to do with people, I'm in a BNI group here, and we were doing this swearing in ceremony, and everyone had to raise their hand to the square. And I joked later in that meeting, I looked at 80 of you guys, and none of you could chest up, shoulder out. All of you are collapsed, and this is about as far as you can go. And then I told them, try it right now. Chest up, head back, bring your shoulder, and people are just groaning and stretching, and it's like, we're not even doing hard movements.
Yep.
But you don't realize how much you get stuck in your typical daily life positioning and how bad your posture and your range of motion becomes. And then when you're 50 or 60 and it's horrible, you go see one of us and you're like, oh man, what do you think happened? Well, you lived 50 good years of life. You've had a good life, but this wasn't a priority enough because you didn't know about it. And
we seek out comfort.
Yeah.
Right. And if you seek out discomfort, then your life will be better. And that on multiple levels. So whether it's professional discomfort or emotional discomfort, or because we become resilient based on the discomfort we face. I love teaching. Mark that.
Put that line in there. That's a good one. Yeah, that's deep. I can think about that for a while.
A lot of patients I've worked with they're 85 years old. And they'll tell me, I'm 85. Do you really think I should be walking right now? I'm like, you should be running. Why aren't we running? Let's go run a couple miles.
Oh.
But the reason they're not is because yesterday they didn't run 3. 10 years ago, they didn't run 2. 5 years before that, they didn't run 1. So what did you do the last 10, 15, 20 years determines what you're capable of now. And what you do today determines what you'll be capable of 10, 20 years from now.
And that's hard, right? It's hard for people because it means changing up their life. We were talking about being authentic, and that means having to be humble and acknowledging I gotta maybe get up 20 minutes earlier, which means I have to go to bed 20 minutes earlier, which means I can't watch the show, and it does require a little bit of effort for sure. And I think the more that we can empower people, a lot of healthcare is from a negative standpoint, right? We are symptomatic. We try to treat. A lot of medicine is like the treatment of disease, right? Pathogenesis. What's wrong with you and how do we treat what's wrong with you versus salutogenesis. What is right about you? How do we strengthen healthy factors, healthy behaviors in you? And I like that approach a lot with my clinic is I'm not going to focus on the wrong. I'm going to focus on the things that you have that we can improve on and enhance and upgrade. And it's a small subtle energy shift, but
it's a subtle energy shift, but on top of that, it's a really good concept of strengthen your strength, your strong areas to support the weaker areas, and it's preventative.
Yep,
that makes a big difference.
And that's hard, but I think as a society, are way more open now to proactive than we were 20 years ago.
Yeah,
people are doing stuff that they've never done before. They're open. They're wanting something. And now it's up to us as the providers to reveal it, show it in a way that makes sense, and just be there to empower.
Yeah. I love that. I think anybody out there who's looking for a chiropractor who they can trust should come work with you. Like,
I appreciate that.
At least come interview you. I don't know if you do that, but we do that at our clinic.
That's cool.
Anybody's allowed to come interview their provider before hiring them, just
Cool.
like you'd interview an employee, right?
Yeah.
And come interview us. Are we the right fit? If not, I've got 500 PTs I know of, and
Totally.
I'll introduce you to the top 5, and then from there you can keep going. Find the right provider for you.
I completely agree, and it's not a problem. It's I go to the same barber for a reason. I go to the same dentist for a reason. It's not just the product; it's the experience. It's their behavior, you know. So
Right.
I get it, and I support it too. And from a selfish standpoint, as a provider, if you don't work with me, I don't want to work with you. You know, because we are going to have a discord maybe, and I want us both to be in a great position to succeed. And I want you to get the health that you need.
Right.
And if whatever is the problem, let's correct it for sure.
Well, and that it is, we care about patients. That's a big part. But I have a lot more fun helping people who do match my vibe and who want to work hard. And there's multiple criteria, right? And so I think it's a win-win for both of us for you to find a different PT.
Yes.
Or in some cases, go to chiropractic instead of PT or vice versa, right? So I think if we all focus on that, why is that not commonplace? Because people want more business.
Yeah, it's
They want to stay busy.
Fear mentality.
Yeah, and instead of, Brody talks about this all the time, the abundance mindset.
Oh, love that.
That's
abundance is huge.
Yeah, if you have an abundance mindset, what you have, every aspect of your life doubles, triples, quadruples just because of that mindset. And we could go on for hours about that. I did want to bring you back a little bit to auto accidents.
Yeah, let's circle back.
What has been your approach in the past, or what advice, actually, let's reframe this question. What would be your advice to any chiropractors who are listening, not referring to PTs, or any PTs and chiropractors listening who don't touch auto accident, they're scared? I guess that's 2 questions. Let's start with the first one.
Okay.
What's your advice to chiropractors not referring to PT for someone who is in a car crash?
I would ask them, truly, what is the rationale behind it? Is it because you think the PT is incapable of providing the care and the standard of care that patient needs? Because if it's that, then okay, find a different PT. But if it's any other reason, if it's financial, if it's the ability to keep them in house, and I want to have oversight of it. Well, okay, I would just question. Again, I don't want to attack people because people have their own approaches, and it depends. But for me, like I said, I know what I do really well. I trust in that because of the focus, the educational background. And if I don't feel like I'm doing the best 100% thing for that patient, then I should be seeking out someone who will also take that energy into that health need in their life.
Right.
Long story short, I love being able to refer out to other experts because I know that's what they do great, and that's going to truly help that person. And when that person gets that great care, they're going to send their families back to me. They're going to come back to me in a year when they have a problem. And at the end of the day, I'm going to sleep better knowing I truly cared about them versus making an extra $50 or $1,000. I can make more money. I cannot buy that relationship or that public trust, no matter what. There's no way to acquire that. So I just have to put that out there and trust.
I love that, and just like we talked about the abundance mindset, if you focus on being that reliable person, they're gonna send their family and neighbors back to you. Before we go to that second question, let's turn that around. What would you tell PTs who won't refer to chiropractors?
Man, the profession's growing. The chiropractors that are coming out of school are I think very different. It's a big history, right, with different professions. I mean, in the 60s, the MDs ran smear campaigns on chiropractors. They stuffed the medical student schools with flyers, with hate flyers, because we were getting people well that had been unable to get well in their offices. And so it was this weird issue. And I think that just carried over with physical therapy. And again, it was that greed mindset. Why would I refer to a PT if I can do exercise therapies? And I can do the same thing in my clinic. And it's just PTs. Chiros are graduating with a much more collaborative mindset and approach. And I think we're seeing that with how they're practicing.
So any PTs out there practicing,
chiros. Yeah.
That's what I was going to say. If you're a PT out there, go talk to chiropractors.
Totally.
Go interview them. Go take them out to lunch. Ask them about their practice and their philosophy. And when you find one that you're totally against their philosophy, great. Don't refer to them. Go find some other ones, right? I think there's really good chiropractors and really good PTs and some bad of both. So to the other question,
Yeah. What was that one?
chiropractors and PTs who don't touch auto accident cases for whatever reason, fear and whatnot, what would you tell them?
So I know there's a demographic that doesn't want to deal with the insurance side of things, right? The
For sure.
oversight, the a phone center employee telling me, a doctor, what I can and can't do. There is an ego aspect. So I have a lot of my graduate friends that, they don't take any insurance cases at all. They are out of network, only cash. I think auto accident, though, is just such an unfortunate, great way to connect with people that might not any other way. Because, well, let me say this. I was talking to my dad about AI and the jobs that are going to disappear in 20 years.
Yep.
And I said, I like to think that I'm protected because I'm a hands-on healthcare providing service.
Yeah.
But you know what's funny? People will not tolerate not having running water. They will not tolerate having a broken AC. They will tolerate low back pain for 20 years before they come in here. And so it is kind of hard because so much of our job is getting people to understand, A, you don't have to endure pain. It's not cool to tough it out. B, invest in yourself earlier so that your later years are great. And so auto accidents, it's an unfortunate, great way to sometimes get people to take their health seriously if they've had this big of a disruption, because they might just tough out whatever they have been going through previously.
Yeah.
That's kind of wordy, but
I like that.
helping people get out of their own way.
Yeah.
Frankly, and I do it too. I've lived with a wonky tooth. I need to go see the dentist, but I just I'll wait until it falls out of my mouth or something. And so it's just the psychology of today, right? We are taught to tough and power through. Auto accidents are a weird bridge, but more importantly, your life has been disrupted. You really need to be made whole, and small symptoms in the beginning do not mean small problems. Yeah, it's horrible.
Yeah, and I think not only is there a lot of help people need with auto accident, but the PTs and chiropractors who are afraid to hold a lien or don't know how to approach it should really start interviewing.
Maybe I'm ignorant, but I just don't even see, I've never even had the fear of that. I mean, I don't know.
I've talked to several PTs and chiros who are afraid of that and avoid it altogether. I think if they talk with people like you who have done this in your career, or lawyers who deal with people who are in a car crash, and start asking questions, get involved, because the world needs more and better providers for auto accident cases.
I'm trying to think, I'm really hung up on that, the fear. I mean, is it like a cash flow issue where they feel that?
I think some of it's cash flow. I think some of it's their fear that they'll document something wrong, or they'll miss something, or they'll get called into court or whatever.
Okay.
It's not near as scary as they think.
Get some good billing help. Yeah. Either if you want to run all in-house, props to you. That's a lot.
Yep.
But okay, the great thing is there's so many resources for that. Yeah. We have so many different courses online or in state that will help with that. And I would hate for that to be a reason to keep you from helping people, that I'm going to code it wrong. Okay, work with your malpractice. I'd like to improve this area of my life. Do you guys have courses to help me? And again, some of the new note-taking software is starting to balance your SOAP with what you've entered in, diagnosis code-wise, and it will point out inconsistencies or red flags.
Yeah,
so I think,
catch it for you.
Yeah, it'll tell you, hey, this actually doesn't really line up, or what you've entered does not justify this code. And so, I mean,
I like that.
I would encourage people to try to be open to it, and maybe before they take them all on, try to see if there's a way for them to, because people need it. There's accidents every day, especially on states with PIP coverage. People are able to come in and get it seen soon. So
yeah, and if they don't come and see us, then it's unfortunately a lot of pain medications and more surgeries or suffering for longer. The biggest thing for me is 2 years later, 4 years later, these whiplash injuries are now worse and come back with a vengeance. So yeah, I'm a big fan of that. So what's the best way for people to reach out and contact you?
Man, Murray Chiropractic and Car Accident, just Google us. And I say that because we have a parent company, which is Utah Chiropractic and Car Accident. So either way, you're going to land with us.
Perfect.
And, we're right by Tosh and Fashion Place Mall, so we're easy to find here in Murray.
Right off the freeway.
Right off the freeway.
Easy access. Yeah. You could come from Ogden.
It's a 5-minute walk. So, I mean, if you're going to Mint PT, just know that we're just west of Mint Physical Therapy, the epicenter of health in Murray, right over here. So
yeah, this is the place to go. So one question we ask everybody on the podcast: is what does being in mint condition mean to you?
Okay, so I've been thinking about that.
Okay.
Mint, I think, usually implies, like, I think of like a U.S. mint, like the creation of physical money, right?
Okay.
And so I think mint health is the effort that you put into health. Like, I am doing something to create this. And again, I tell people it's okay to take baby steps. If you never drink water, don't go buy a 64-gallon jug and try to start doing that every day.
Right.
You're going to burn out, right?
Yep.
Let's be realistic, but something is better than nothing.
Yeah.
So being in mint health, I think, is doing things to help create each and every day a little bit better choices that help your health.
I like that a lot. The idea of what effort did you put in to make that all possible. Have you ever heard the quote about Usain Bolt? So Usain Bolt said, I trained for 4 years to run for 8 seconds.
Right?
So what effort are you creating for mint condition to have that health? I want to be healthy. I want this. Great. What are you doing to set that up? And then what are the baby steps to get there? So mint condition might not even be where you're at, but where you're headed.
A lot of people,
That's cool.
A lot of my patients, they will come in with the pain. And I always quickly link that to, but what does this stop you from doing? Get on the hands and knees with your grandkids, taking a flight because you can't sit in a plane. So I always try to correlate what this is stopping them from doing, because that's going to be our actual goal.
Yeah.
Our goal is not pain relief. That will happen most likely because of the ways that I feel confident with what I do or how I refer. My goal is to get you to do that actual event in your life. And that will be the motivator when you need to do your home exercises.
Yeah.
And you're like, I don't want to pull out the stupid band. But then we will have talked about, the goal is to go play with your grandkids, be able to go hiking with them and not have to stay behind.
Yeah.
So
I think if that's your motivator, it all gets a lot easier.
it sounds nice, right?
Yeah, for sure.
It's hard to practice. I get it. So
That's awesome. Well, if anybody's in Murray area or really Salt Lake anywhere, because you're so easy to access.
I got people from Plain City. I've had Star Valley. Come on down.
Go and see Dr. Jackson.
Go and see Brad. Dr. Brad, yeah.
The last name's too hard to
I was
say.
going to say
Not worth it.
Clementons.
Nope. Just Dr. Brad.
Dr. Brad. I like that.
Well, thank you for coming on. I'd love to have you back again sometime, talk more of this philosophy. I feel like we've got several topics that we're going to do an episode on each one.
I jumped around a lot. So
No, it's good stuff. Thank you.
Thank you. Appreciate it.
Yeah.
I'll be back.